Welcome to FYIVT, your inside source for news and in-depth analysis on what's really happening in Vermont. We want to start by saying thank you to all our listeners and supporters. Your continued encouragement fuels our mission to dig deeper and bring light to critical issues that shape our communities. We couldn't do this without you. Today, we're diving into our article titled, "The Many Costs of Vermont's Drug Policy." Vermont's battle with the opioid crisis is nothing new, but the way the state has responded is worth taking a closer look. The approach Vermont's legislature has adopted focuses on harm reduction, with measures like needle exchanges, safe injection sites, and expanded access to naloxone, a drug that can reverse opioid overdoses. While these measures are well-intentioned, there's a growing concern about their long-term effects, both financially and socially. One of the most concerning aspects of these policies is the effect on children. Public drug use is becoming more visible, and kids are witnessing behaviors that normalize drug consumption. What does it mean for our children to grow up seeing drug use on street corners, in public parks, or near schools? Early exposure to such behavior can send a harmful message that these actions are acceptable. For Vermont's families, this shift in the social environment is deeply troubling. They want safe communities for their children, not ones where public drug use becomes just another part of the daily landscape. Vermont's policies seem to be creating a dangerous precedent, especially for its younger generation. This is a state with a small, tight-knit community, yet increasingly, those who are trying to raise children here are finding themselves in a position where they're forced to worry about the growing normalization of something as damaging as drug abuse. Now, let's talk about the financial burden. Vermonters are already dealing with some of the highest tax rates in the country, from property taxes to income taxes, and now more money is being allocated to programs that don't focus on solving the root causes of addiction. Programs like safe injection sites, which are being funded by taxpayer dollars, are designed to prevent overdose deaths. But what about the long-term effects? How much are we spending to manage an ongoing problem rather than addressing the cause of it? In recent years, the state legislature has directed millions toward harm reduction, including a $1.1 million investment in the Burlington Safe Injection Site alone. That's money that could have gone to creating better treatment options or helping to provide rehabilitation programs for those struggling with addiction. Instead, it's funding spaces where drug use is not only allowed, but also somewhat normalized. The logic here might be that saving lives in the immediate sense is worth the cost. But this view overlooks a larger issue, the money that could be invested in a more comprehensive solution. There is no clear call to reform drug policies in a way that challenges those who are using drugs to take personal responsibility and find a way out of addiction. With taxpayers footing the bill, there's little incentive to change a broken system. And then there's the children again. As a society, we should be asking ourselves, how many of Vermont's kids are being exposed to a culture of permissiveness around drugs? What happens when children grow up in an environment where drug use is becoming more visible and more accepted? We may be setting them up for future struggles, both as a community and as individuals. It's no surprise that when harm reduction becomes the primary focus, it's easy to overlook the social costs, the impact on families, communities, and yes, the children who should be protected from the horrors of addiction. The focus should be on programs that offer people the tools to recover, not simply creating safe places to keep them trapped in their addiction. We must demand better, not just from the state, but from our communities as a whole. Vermont needs a solution that addresses the underlying issues driving the drug crisis, not just a temporary fix. Addiction is a disease, but it's also a consequence of choices. Those who struggle with addiction deserve help, but that help needs to encourage long-term recovery, not simply acceptance of the problem. The state should invest in rehabilitation programs, job training, and long-term recovery programs that demand accountability, offering individuals the opportunity to reclaim their lives rather than managing their addiction for them. More than just providing spaces for people to continue using, we need to encourage recovery, real recovery. Offering incentives for individuals to make changes in their lives and break free from addiction must be the primary focus. Simply tolerating drug use isn't solving the problem, it's merely managing it. Vermont's current approach is clearly flawed, and many of its hardworking tax-paying residents are beginning to realize that they are being asked to bear an unfair burden. Why should the public be footing the bill for a system that doesn't ask enough of those using drugs to make meaningful changes? Instead of expanding harm reduction, let's expand access to programs that demand change. Let's invest in treatment that encourages personal responsibility and holds individuals accountable for getting better. It's time for Vermont's legislature to shift gears, focus less on managing addiction, and more on solving it. More funding should go into treatment programs, rehabilitation, and mental health support, because that's where the long-term savings are. Addiction doesn't need another safe space to continue. It needs real intervention, real care, and real solutions. Vermont should be leading the charge in helping people overcome their addiction, not by managing it, but by empowering individuals to take control of their lives, rebuild their futures, and strengthen their communities. There is no quick fix for drug addiction, but there are better ways to spend public resources that will yield lasting results. The true cost of Vermont's current drug policies isn't just about dollars and cents. It's about the future of our communities, the safety of our children, and the long-term health of our state. Freedom is the foundation of prosperity. Stay informed, stay vocal, and most importantly, stay free. Thank you for listening to this episode of FYIVT. To read the full article and explore more on what's happening in Vermont and how the state works, visit us at FYIVT.com. We appreciate your support and look forward to continuing to bring you important perspectives on Vermont's most pressing issues. Until next time.